we must have seen, you all must have seen a lot of these, and such horrible X-rays. It's time to revisit this, and this. I hope you all must have come across happy patients, satisfactory patients with the knee, but they often complain about the ankle and the foot pain down the line, 2, 3 years, 4 years. So what options do you have? So we would have treated with conservative, skillful neglect, orthosis, fusion. What else? It's total ankle replacement. So ankle arthritis, you all know, is a debilitating malady. We all have only one option in mind, surgical option, which is arthrodesis. Arthrodesis has often several disadvantages in terms of high rate, non-union, malunion, prolonged immobilization, revision surgeries, development of adjacent joint arthritis, which is quite significant, and decreased patient satisfaction as compared to total ankle replacement. So what are the indications? Persistently painful arthritic ankle, most commonly post-traumatic rheumatoid inflammatory disorders, some congenital issues which limit activities of daily living, and all kinds of patients which have failed all the non-operative therapy like painkillers, NSAIDs, braces, corticosteroid injections. So what are the ideal criteria? So ideal criteria earlier were age more than 50, which was preferred. Nowadays, even younger patients are undergoing total ankle replacements outside India. BMI less than 40, non-smoker is an important criteria. Good range of motion, and coronal deformity should be less than 15 degree of varus and less than 20 degree of valgus. What are the contraindications? So missing malleolus, defect in talus or tibia, subluxated ankle, significantly subluxated ankle, malunited deformity in the tibia, AV and avascular necrosis of talus, neuropathic joints, and obviously peripheral vascular disease and significant comorbidities. So what are the implants of total ankle replacement? So we just brushed through the history. It started with agility ankle, which is now discontinued, which was the first generation. Second generation is the star implant, which is Scandinavian total ankle replacement. Third generation, and now on, which is inbone, most commonly used in USA. Integra, Zimmer, and Saltotaris, commonly used in European. And fourth generation nowadays are Infinity, Vantage, Cadence, and Prophecy. Prophecy is now the latest one, which consists of 3D, the 3D printed jigs, customized jigs for every patient. So bearing type, as we have seen in the knee, it's also already there in the ankle, mobile as well as fixed bearing. Mobile bearing has a 3-component, fixed bearing is 2-component, where the poly is fixed to the tibial tray. The mobile bearing has unconstrained tibial, talar, and polyethylene components, which theoretically provides better stress distribution. So what are the forces as we compare the hip and knee? So ankle has the smallest contact area as compared to the almost 1/3 of that of hip and knee. So the peak forces are too much in the stance phase of the gait. So this was the original Saltotaris, which is still there with some modified version. It's a 3rd generation, which was FDA approved in 2006, and which has overall 95% survivorship at 5 years. It also has a revision system, which is Saltotaris XT, which has a unique component in which the tibial tray is mobile, which uses, the tibial trial is mobile when placing the talar component. As we all see that in TKR, the tibia is balanced as per the femur. Here, tibia is balanced as per the talus. One of the known companies of total knee replacement also has a total ankle, which is only lateral based approach for the total ankle replacement, where you have to do fibula osteotomy and approach. Only advantage is it has curved bony surfaces, so better anatomic and biomechanical stability. But only disadvantage, we have to osteotomize the fibula and fix with a plate. So the star ankle, which is also commonly used in European nations, is 3-component mobile bearing. Recently, they have designed it as a titanium plasma porous coating with hydroxyapatite to allow bone ingrowth. In bone, most commonly used in USA. So it has a modular tibial system. So we can see here are the pegs. So it has an intramedullary jig which is retrograde from the calcaneum into the tibia, and the jigs are placed. So good tibial attachment, and it has different kinds of talus trays also. So with the intramedullary guidance, there is increased stability, greater force distribution, and decreased shear. Another fourth generation is Cadence, which is of Integra Life Sciences, which is also 2-component fixed bearing. Nowadays, the ankle replacement are shifting from mobile bearing to fixed bearing. Another one is with Exatec, which is Vantage, also comes with 2 and 3 component, but nowadays, as we said, more used is 2 component. Infinity, as we can see, and now this is presently available in India, which is H3 total ankle replacement, which is Hinterman series, and which also comes with 2 component and 3 component, but mostly again it is used with 2 components. So post-op protocol, again we have to immobilize for a week, and walking cast can be given for 3 weeks, followed by full weight bearing at 4 weeks and 8 weeks in the regular shoe. So what are the complications? Again, as this meta-analysis was seen, the most common complication is because of technical error. Second one is subsidence of the implant, most because of the polywear, implant failure, which is quite less, aseptic loosening, intraop fracture, wound problem, and deep infection. So overall survivorship, as per this meta-analysis, was 93%. This was 15-year-old follow-up, 15-year follow-up. Yeah. So again, another survival up to for 15.8 years was 76.1%, almost nearing the total knee replacement survivalship. As we see the comparison of the different implants, the survivalship is pretty good. At 10 years, it was for the star implant was 90%, and 15 years is 87%. The newer implants, the Inbones and Infinity, their 15-year follow-up is still yet coming. So the evolution started with agility, salto teres, and nowadays these implants are available. And last one is the prophecy. So understanding the endpoints to give reliable pain relief, better functional outcome, reduce adjacent joint arthritis, which is the most important advantage of total ankle replacement. And we have seen just some theories which say that total ankle replacement compared with ankle arthrodesis, how much disability it is creating, ankle arthrodesis. So again, as we said, only disadvantage with fusion is adjacent joint arthritis and altered biomechanics. Thank you.